close contacts. The remaining 2 are under early investigation. Of those 11, only 3 were in quarantine during their entire infectious period. We're aware that 7 have spent at least part of their infectious period in the community, and there's 1 that's still under further investigation. We have 11 people hospitalised, but just 1 remaining in intensive care but still on ventilation. Testing numbers yesterday were just a little short of 2,500, 2,488. So again, as we've been seeing day on day, there's still a proportion of the community who are delaying getting tested when they're developing symptoms. They're waiting a day or 2. This is one of the major reasons why there are still cases infectious in the community. So if you have any symptoms, please come forward for testing. Also, if you have been at one of the exposure sites that are listed on the COVID-19 website, if you've been at those sites at the times listed on the website, please come forward for testing as soon as you possibly can. ACT Policing, Access Canberra and WorkSafe ACT continue their strong compliance program across the Territory. There were 426 traffic stops yesterday and only 3 directions to leave the ACT. I'm pleased to be able to report that both ACT Police and Access Canberra business compliance checks are showing an improvement in mask wearing at businesses. The Chief Police Officer indicated to me this morning that the overall compliance across the Territory with the public health directions is very good. So thank you to Canberrans, to businesses that are doing the right thing. This is how we can operate businesses and have some economic activity in our community in a COVID-safe way if people do the right thing. And particularly, the wearing of masks is a really important part of our public health response. Being a Monday, the government will update its priorities for the week. This week, we're focusing our efforts on vaccinations. Over the next 7 days, we aim to get the first dose rate for 16 plus Canberrans to 75% and our fully vaccinated rate for 16 plus Canberrans to 50%. The Chief Health Officer has provided advice that due to the current outbreak, the period of time between doses for the AstraZeneca vaccine can be revised. This is similar to the advice for the vaccine in Victoria and New South Wales and follows guidance from the Australian Technical Advisory Group on Immunisation, ATAGI, that this is an appropriate response. So if you have already received an AstraZeneca vaccine or you are planning to get your AstraZeneca vaccine, your second dose can be administered 4 to 8 weeks after the first. This will enable you to get full vaccine protection sooner. Now, as we've been saying, and I'll reiterate today, the best vaccine is the one that you can get today. For many, that is the AstraZeneca vaccine. It is available through local GPs, pharmacies, and the ACT Government Clinic at Calvary Hospital. You can get AstraZeneca today. Now, over the next 7 days, the ACT has 24,000 Pfizer bookings between our AIS and airport mass vaccination clinics. This will be the single largest week of Pfizer vaccine distribution and delivery for the ACT, and we will build on this in the weeks to come. Health authorities are currently evaluating the best way to deliver more vaccinations more quickly. With the additional supply of Pfizer that is coming to the ACT over the next month, and there's been some media around the arrival of that first shipment from the United Kingdom. As that continues week on week, we'll be able to vaccinate more people more quickly. This will involve a delivery partnership with GPs in the ACT. But we are also working with pharmacies on the rollout of the Moderna vaccine when shipments begin to arrive into Australia and into the ACT later this month. So we will update the community as soon as we have greater certainty on the timing, the exact timing of the arrival of these mRNA vaccines into the Territory. Now this week we begin a 2-week program to vaccinate ACT students who are required to sit the AST in person. So we're asking students to come forward and get their vaccination over the next 2 weeks, those Year 12 students. Most have already made a booking, but if you haven't yet made a booking, please contact the ACT COVID-19 vaccine booking line and you will get priority access over the next 2 weeks. So in summary, for those who've joined late, 11 new cases, 9 of them linked, only 3 in quarantine for their entire infectious period, 7 infectious in the community for part of their infectious period, 1 still under investigation, 11 people hospitalised and 1 remaining in intensive care. And again, thank you to the staff at the Canberra Hospital Intensive Care Unit for the outstanding care that they're providing that individual. The Deputy Chief Health Officer, Dr Johnston, will now provide further update on new cases and epidemiology, and then Minister for Health, Rachel Stephen-Smith, will provide an update, and then all 3 of us will be available for questions. Thank you.
Good morning. I'm Dr Vanessa Johnston, ACT Health Deputy Chief Health Officer. So as the Chief Minister has just said, since our update yesterday, the ACT has recorded 11 new COVID-19 cases. Our total cases for this outbreak is now 385. A total of 163 of our cases for this outbreak have now recovered. That's 26 more than yesterday. This leaves 222 active cases. Of the new cases today, I can confirm that out of 11, 9 were linked to known cases or ongoing clusters, and 2 remain under early investigation. Out of those 9, we know that 7 were household contacts. Out of the total 11, 3 were in quarantine during their whole infectious period. 7 spent some of their time in the community while infectious. 1 remains under early investigation. We have 11 people in our households. 1 of these is in ICU and is being ventilated. 7 of the 11 are unvaccinated and 2 have received 1 dose. The vaccination status of 2 patients are unknown at this time. We now just have over 1,400 self-identified close contacts and over 330 active exposure sites. Please, as always, continue to remain up to date with the ACT Government COVID-19 website to check for any updates on exposure sites and changes in time or dates that may occur as our investigations are ongoing. To provide you a little bit more detail of the epidemiology and our cluster analysis, the age breakdown is very much unchanged from recent days, so I'm not going to read that on the record today. We continue to have 14 public sites of transmission. Overnight, 1 additional case has been linked to Bid Food, Canberra. So as we discussed yesterday, getting tested immediately if you have symptoms is really crucial, regardless of how mild they are. Our testing numbers over the recent days, as the Chief Health Officer has previously indicated, are too low. We want to see those over 3,000 a day so that we're detecting any transmission in the community early. This is going to keep ourselves, our friends, our families the safest we can during this time and during this outbreak. The other thing to remind people is just don't stop at the shops or anywhere else on the way to getting tested or on the way home from testing. We want you to go directly to a testing site if you've got symptoms, if you're a close contact or a casual contact and you've been directed to get testing, and go directly home. You may think that a quick trip through a drive-through or a quick stop off at Woolworths, with a mask, is without risk, but that's not the case. It comes with risk and will potentially be listed as another exposure location, another lot of work that our site liaison officers need to do in risk assessing that site and communicating that to people who've been there at the same time as you, if it is subsequently found that you test positive after having the test. So in our case numbers today, you'll see that 7 of our cases have spent some of their time infectious in community. And some of that time arises from individuals doing those quick stops to pick up some takeaway or to go to the chemist or to Woolworths on the way there or way home. So we ask you to not do that. And that's going to protect the community the best way you can. So my shout out today is to the amazing Canberra community. That's everyone out there. It's so wonderful to see the community again, once again, stepping up to this challenge, from the volunteers and small businesses who are cooking and delivering food to those in need, to those building community spirit and cardboard bus stops. If you haven't seen these examples of art installations around the community, please go to the ACT Government Facebook and you can see them there. Our entire community is really showing what it means to be Canberran, supporting each other, checking on those who are doing it tough while we're in lockdown. Thank you all for doing your bit. It's going to help us get through this time. Thank you.
Thank you, Vanessa, and hi, everybody. I'd like to start with some good news in relation to the progress of the vaccination rollout for people with disability and NDIS staff in particular. The Commonwealth has provided some updated data on disability vaccination rates as of the 3rd of September. And the good news is that the number of NDIS workers with a first dose has increased by more than 10 percentage points since the 23rd of August. So that's now at almost 69% at a first dose, with more than 46% fully vaccinated. I would like to take this opportunity to remind disability support workers that there is a dedicated telephone line for frontline health, aged care and disability workers to book your vaccination appointment. So that number should have been received from your employer or through NDIS. So please use that phone line and book in your vaccination appointment to protect yourself, your family and the people that you care for. And that work is greatly appreciated. There's also been a 3 percentage point increase in NDIS participants vaccinated with 1 dose, which is now at 61%. So that's another 143 NDIS participants since the 23rd of August. But we know that there are many people with disability in our community who are still wanting to get vaccinated. Many people have been accessing our vaccination clinics at Garran and the airport precinct. But we also recognised back in May that these mainstream clinics might not be an appropriate environment for some people with a disability. And that's why we opened the Access and Sensory Clinic, which has been located at Garran. This clinic is available for people with disability and their support workers and carers. It offers a quieter space, longer appointment times, a separate accessible entry point for wheelchairs and other mobility equipment. And support workers and carers attending the appointment can receive a vaccination at the same time as the person with a disability. From next Monday, the 13th of September, the Access and Sensory Clinic is moving to a dedicated space at the Western Creek Walk-in Centre and increasing its operations from 2 days a week to 5 days a week. So Access and Sensory Vaccination Clinic appointments for tomorrow, Tuesday the 7th of September, will remain at Garran. Appointments for Thursday, will be rescheduled to next week to allow for the move, and people with affected bookings for Thursday will be contacted directly by ACT Health to reschedule their appointment into early next week. Bookings from next week onwards will be moved to the new Western Creek Clinic, and with the increase to 5 days a week, there will be additional appointments available. So people who have existing appointments through the Access and Sensory Clinic will be contacted to bring their appointments forward, with a particular focus on those who have been waiting longer. From Thursday, the 9th of September, so this Thursday, appointments can also be rescheduled by calling the COVID-19 vaccination line on 5124 7700 7700 between 7 a.m. and 7 p.m. and selecting option 3. The COVID-19 testing clinic at Western Creek will, of course, no longer be operating, as we have discussed previously, with that service moving to the Canberrans Surge Centre this Wednesday, the 8th of September. So that will also enable us to establish a dedicated access and sensory testing service at the Canberrans Surge Centre from Wednesday, as well as a walk-in testing site for the general public. The testing clinic at the Canberrans Surge Centre will open a little later on Wednesday to allow for the move of equipment and staff, so please check updates on the ACT Health's social media accounts. And I know that many people with disability will welcome this move, as people have indicated that a more appropriate space for testing is an important thing for them. Before I hand back to the Chief Minister, I'd just like to highlight one other thing on behalf of our health services. We have had some reports of people attending healthcare appointments without declaring to our staff that they are awaiting the result of a COVID-19 test. On some occasions, these people have subsequently received a positive result from the test that they were awaiting. This is not okay. This puts our staff and other patients at risk. Our hospitals and health services have a screening tool to determine whether or not it is safe to come in for an appointment. Please complete this screening tool honestly. You will not be denied urgent care because you are awaiting a test result. However, the facilities do need to know before you arrive so that they can put the necessary precautions in place to keep everyone safe. This is another line of defence for our healthcare workers and our patients and the vulnerable people who are receiving supports in our services. So please, for anybody who is attending a healthcare setting, please complete that tool honestly. You will not be denied care, but it will enable appropriate arrangements to be put in place to support you and everybody else. So with that, I will hand back to the Chief Minister for questions. Thank you.
Thank you, Rachel. We'll go to questions.
Good morning. Just to start with, we just have had some reports that the Prime Minister returned to Sydney on Saturday and came back this morning. Are you aware of these reports? And was the Prime Minister given an exemption by ACT Health?
Yes, I understand he may have travelled back to Sydney. I will need to check on the status of his exemption. I'm sure he has abided by the requirements.
Just looking at the reduction of the number of weeks between vaccinations potentially for AstraZeneca, people taking AstraZeneca, will people who have less weeks between those vaccinations be prioritised for booster shots in the future? And what's the sort of status of being able to get those booster shots in the future in terms of availability?
Sure. So the booster program is one that is a feature of both National Cabinet and National Health Department planning. The securing of the vaccines to do it, I understand, has occurred, and that it will be a rolling program throughout 2022. The exact details of that I don't know today, but people will be advised of that, and there has been some discussion amongst health authorities in relation to those who've had the AstraZeneca vaccine having an mRNA booster. But I don't have further details on that today. That will be a decision informed by groups like ATAGI and AHPPC and communicated to the nation in due course.
Chief Minister, there's a long list of exposure sites today. Are we simply just getting around too much, or is this just to be expected?
Well, it's a feature of there being some level of movement, but when you look at the sites, they're principally ones that are essential to be open. So this goes to the balance that we need to strike. That the more movement of people, the more places that are open, the more likely they will be exposure sites, given the virus is in the community. So I think this serves as an important cautionary tale about the gentle steps that will be needed as we begin to reopen economic activity, that it's not all going to occur at once, and it needs to be measured and as low risk as possible.
But sorry, are you happy though?
Am I happy?
Are you happy about the number of exposure sites? Are you satisfied?
Well, I prefer them to be low. I prefer we didn't have a virus circulating in our community. So there's probably not much about the situation that we're in at the moment that you would describe as being happy. It's a question of needing to balance risk. I mean, people do need to eat. They do need to go to supermarkets to buy things. The conclusion that I draw from all of this is that I would minimise my time in supermarkets. I certainly wouldn't be going every day, and I'd do my best to ensure that I'd get what I need and then get out. I don't think hanging around supermarkets is a particularly great idea at the moment. I would just get in, get what you need and leave. Every time you come anywhere near another person, you are potentially putting yourself at risk. You can't eliminate risk entirely. We do need to interact with some other people some of the time, but I wouldn't be going out of my way to maximise the number of interactions with other people. I'd be going the other way and seeking to minimise them.
Chief Health Officer yesterday said that about 5% of cases indicated that it might have been new introductions from New South Wales. Today in New South Wales, we've also seen their outbreak is spreading further south.
Yep.
Batemans Bay, Shoalhaven, sewage fragments continue to be detected across the region. I mean, how concerned are you about that? And is it just like we're not going to be able to put a lid on this thing until we get those vaccination rates up?
I mean, in short, very. I've been making this point every day that when we need to think about what our public health settings are around controlling the outbreaks that have come into the territory from New South Wales, but that we're going to face ongoing risk of that for many months. So the challenge and the balance of the settings that we need to strike are that as we continue to vaccinate more people and build up the total community protection, we still need to test, trace, isolate and quarantine, and we still need to have public health social measures in place. Now, at the moment, we are dampening down the risk through the combination of all three, of a nation-leading vaccination program, a lockdown, and extensive efforts to test, to trace, to isolate and to quarantine. And all three are combining to leave the ACT in a better situation than what we're seeing in New South Wales. But no, the risk is going to be, that's why I said at the beginning, it's going to be a really tough spring. The risk doesn't go away, it's there every single day until we get our vaccination rates up to the highest possible level, and similarly New South Wales does the same. So I think it's fantastic that New South Wales continue to have the nation-leading first dose vaccination rate. That's really encouraging. That ultimately, after their case numbers peak and start coming down, and after their hospitalisations peak and start coming down, that the risk from New South Wales will begin to ease. But it's still months away. And that's the awful reality that we face here, just as every New South Wales resident faces, and increasingly in Victoria and then the other Australian states that have got hard borders trying to keep the virus out whilst they furiously vaccinate. That's our task over the next several months. And we will always be at risk in this period from New South Wales, but it's not just about New South Wales, it's also about internally within the ACT. And Canberrans going into New South Wales can bring the virus back with them as well. It's not just New South Wales residents who might be coming into the ACT. The risk goes both ways.
Chief Minister, you noted some of the other states that have already shortened the interval for AstraZeneca. Has that given you, particularly New South Wales, has that given you any indication of what the take-up might be for people moving their appointments forward? And if so, how much does that change the ACT's timeline for our double doses?
It obviously helps in bringing it forward. We're already seeing evidence through both our bookings and those that are being delivered through GPs and pharmacies that people are bringing forward their second AstraZeneca dose. Everyone who does that obviously gets their full vaccination weeks ahead of when they otherwise would have. We've had a really strong over 60s AstraZeneca program running for months and months and months, and you see the first dose rate for over 70s is 95% plus. So this ought to mean that group will get to 95% fully vaccinated a few weeks earlier than would otherwise have been the case. It also poses a question for younger people as to taking AstraZeneca now to get that protection, because a single dose is better than none, and fully vaccinated with AstraZeneca is better than none. But with the combination of 3 vaccines, AstraZeneca now, Pfizer if you've got an appointment, and then Moderna coming online, I think this means the total vaccination program will be able to be completed more quickly.
Can you give an update on compliance over the weekend, given there was a slight easing of some restrictions, particularly around, maybe people picnicking, although I know the weather wasn't particularly good for that?
Probably wasn't peak picnic weather over the weekend. The feedback from ACT Policing, Access Canberra and WorkSafe has been that compliance has been very, very good. The consistent themes of the last few days still remain as, for those who are not complying, the major issue is around face masks and not being worn correctly, particularly in business settings. So throughout our outbreak and what has been experienced in New South Wales and Victoria is that the 2 main points of transmission are within the household. So someone gets infected, brings it back home and infects all the unvaccinated members of their household, and workplaces, where someone gets infected and infects their close work colleagues, who in turn then take it home and infect their close household contacts. So the biggest areas of risk and of focus are around households and workplaces. And that's where the compliance efforts have been, and that's why the public health directions are what they are, to minimise risk in those 2 particularly high-risk settings.
One of the sites on the list today was the Australian War Memorial construction site. You know what the situation is on that site, and does this change anything of your view for the construction sector?
Look, I'm not fully across the nature of the exposure there. I understand it might not actually be a construction worker, but someone who walked through the site or near the site. the Deputy Chief Health Officer may be able to give some further information there. But no, I don't think at this point it necessitates any change in the current settings. It's not to say that, we acknowledge this at the start, that construction represents a risk, but there's a lot of measures in place to mitigate that risk. And so we need continued compliance in the construction sector. But the feedback from WorkSafe, from Access Canberra and ACT Policing is there has been very strong compliance from the construction sector to date.
Is the feedback you're receiving about perhaps people waiting for a test is that they fear, they might be in insecure work and they fear that they're going to lose income if they take time off work? And can you just talk me about through the $270 ACT government COVID test hardship payment, because perhaps awareness of that isn't as high?
Sorry, I missed the first part of your first question.
The first part, feedback around...
Feedback, yes.
So people waiting for a test because they're worried about, losing income if they take a few days off to get their test results?
Yes, so there are obviously support payments available both from the Commonwealth and the ACT government to assist people in those circumstances, so both isolation payment, disaster payment and emergency payment. Information is available on the ACT COVID-19 website around access for those payments. Hundreds have been paid in those circumstances, so these programs are being utilised, but I guess it always helps to raise awareness of that financial support that is there for people who may lose income because they either have to isolate or they're in quarantine or for reasons of broader public health settings. And so those payments are available. I would encourage people to look at the information and the eligibility criteria, which is generous for each of those payments. Some come direct from the ACT government, some come through the Commonwealth systems at Services Australia.
Just elaborate a little bit more on that $270 payment that people can receive.
The details are on the ACT government COVID-19 website. They're there for people who need to isolate whilst awaiting a test result. There are a series of emergency payments that are available. So I just don't have off the top of my head all of the detail there, but it is available on the website.
Just a quick one about the rest of government. You're fronting up here every day. Along with Rachel Stephen-Smith and sometimes Eva Berry. What's the rest of your government doing? Is the business of government still rolling on regardless?
Yes, clearly there's a daily operational focus associated with the public health response. So the Security and Emergency Management Committee of Cabinet meets at least every day and sometimes twice a day. Daily operational meetings every morning, 7 days a week. And we then have other cabinet meetings, often 3 to 4 times a week, to deal with both COVID and non-COVID related matters. Ministers have responsibilities that touch upon the public health response in disability, in housing, in public transport, business related, workplace health and safety and compliance, policing. So every single minister in the government is involved in the daily meetings. We often meet 3 times in a day, depending obviously on both the daily operational response as well as the usual business of government. A significant reallocation of resources, though, has occurred within the ACT government operations to push into frontline service provision, call centres, processing payments. Obviously, the communication side is very heavily engaged and focused on the COVID response. But in the background, work continues within Treasury, for example, on the territory budget, and engagement with the Commonwealth in relation to the shared financial responsibilities that we have around business support, for example. So there's been some reallocation of resources, but in the meantime, yes, we have to carry on with all of the usual day-to-day activities of government. A lot of this is occurring with public servants working remotely, and they're doing an amazing job to keep everything going, whilst we are very focused on the day-to-day response to the public health emergency.
Some for the Deputy Chair, if that's okay.
Okie doke. Thank you very much.
Dr. Johnson, can we get an update on how many unlinked cases there are on the ACT, and does this suggest to you, I guess, a significant amount or a trivial amount of undetected COVID in the community?
Yeah, I don't have that exact number for you today, unfortunately, except that it remains a significant number and it is a significant concern. So obviously it's a constantly evolving situation, as we've talked about the kind of forensic investigation that is ongoing every day with cases over a number of days and weeks. But that number of unlinked, or that proportion unlinked, is too high in recent days. You would have noted that from the updates. And so I guess the exact number isn't so important as the fact that the proportion still remains high. And that does suggest that we are missing chains of transmission, and that in part arises from the fact that we still have cases that are infectious in community, unknowingly or otherwise, when they're notified. So it's a concern.
There's been 3 cases in Queanbeyan and Googong region. Are you able to clarify whether those are linked to the ACT outbreak at all?
I think at this time it isn't particularly helpful now to start getting into whether New South Wales cases are linked to the ACT outbreak, or indeed ACT cases start becoming linked to the regional outbreaks. It's in the region, it's here and it's in the region. We certainly have cases in the region that are linked to our outbreak. And we're working extremely closely with Southern Public Health Unit on the sort of investigation of those where there are crossover links.
With the AstraZeneca vaccine, the time gap for the second dose has been reduced. But what would be the advice for people who want to get the maximum benefit out of the AstraZeneca vaccine? Should they, if they really want that, should they wait the full 3 months, and not go for a second dose after 4 or 8 weeks?
Certainly in the scenario that we're in, with a very active and evolving outbreak, that wouldn't be our recommendation. All the clinical trial research on the AstraZeneca vaccine drew out that the 3-month gap does provide the most optimal protection against any infection, so any symptomatic infection. But one dose or a reduced dose between 2 doses provides excellent protection against severe disease and hospitalisation, which is really the main game here that we're trying to avoid. And so when in an outbreak situation, as in Victoria, as in New South Wales, who have all shifted to this recommendation of a reduced dosing schedule, what we're saying is get that protection against severe disease on board early, and do it now, because you don't know when you may be in contact with someone with COVID-19.
So would that mean a booster shot later?
Certainly, yeah. There will be booster shots coming down the line. That's for everyone, regardless of their dosing schedule. You will, at that reduced dosing schedule, it will be recognised as being fully vaccinated in the air. But booster shots are coming down the line for all of us, regardless of the spacing between those doses, or regardless of the vaccine that we received in 2021.
Few questions for you regarding social housing. Can you give us an update on the cases, any new cases we've seen coming out of Ainslie Village or Condamine Court?
Yeah. Just let me turn to my notes here. So the good news with Condamine Court is that the quarantine period for the residents there ended overnight. So as of today, the residents there are no longer in quarantine for public health reasons. So that's 14 days since they first went into that quarantine scenario. And they've done a tremendous job in adhering to that under very challenging circumstances, and I want to really thank our cross-government partners and our community partners in supporting those residents in being able to do that. We're not pulling out altogether. There's still continuing social and clinical wraparound supports and the phone line that's available to residents as we transition out of this really intense support period. So the total cases that were linked to Condamine Court were 3. And we're doing ongoing testing and surveillance at that site going forward. In terms of Ainslie Village, the total cases linked are now 6, and we are still very much in a kind of active management phase of that outbreak. It's still under quarantine requirements as a close contact site, again supported across government and with our community partners.
What efforts are you making to vaccinate the community in Canberra who are experiencing homelessness, and have any of those people been identified as positive cases?
Look, I think I might leave that for the Minister for Health in terms of how our Access to Equity program, in terms of the vaccination of those individuals. So very at risk, and obviously because of their circumstances can't necessarily access standalone or mainstream vaccination services, but I think the Minister would like to take that.
And just lastly on this, is it time to provide hotel-style housing for those vulnerable Canberrans?
Yeah, look, I think this is something also that the government is actively considering. We do have a managed quarantine facility, as you're aware, but it is a finite capacity. We need to think about the safest and best place to quarantine or isolate contacts or cases that are really struggling to do that in their own home circumstances. So that's under active discussion at the moment as to whether we need to expand on that.
Are we seeing any sort of trend with the numbers, or are we still in a highly volatile state?
Yeah, I think we're still bobbing around a bit. That day of 32 kind of put out our rolling mean a little bit. I think the trend in the numbers I would suggest are plateauing, and they were going down. It'd be great to see another couple of days of under 20, and then we're definitely in the right direction, but it's still pretty volatile.
Are you able to say how many individuals have been hospitalised throughout the entire outbreak?
I don't think I have that in my speaking notes. Obviously, people come and go, so we'll have to get that to you at a later date.
Ian? No?
Can I ask, Minister, do you have an idea of how many Year 12 students and staff have booked in for their priority vaccination so far?
I'm sorry, I don't have those numbers in relation to Year 12 students and staff at the moment. What we know is that we were holding about 5,500 appointments for those Year 12 students who were either sitting the Australian Standardisation Test, the HSC or the International Baccalaureate, and the staff that were needed to support that activity. So those vaccinations will be taking place this week and next week. Those appointments are held for those people, but I don't know how many of those have actually been firmly booked at this point in time, but obviously that effort is starting today, which is great.
Just on the AstraZeneca mass vaccination clinic that you've got at Bruce Calvary Hospital, what has demand been like for that? And would you consider opening that up to under 60s?
I don't think we need to open that to under 60s at this point in time. There is a lot of AstraZeneca available in the community, either from general practice or from pharmacies at this point in time. And so our advice has been consistently that people under 60 should seek advice from a health professional, whether that's a general practitioner, a pharmacist, or indeed a nurse practitioner, around their personal circumstances. And there is wide availability of AstraZeneca. So one of the things that we'll be focusing on at our Calvary clinic, which obviously has not unlimited capacity, is ensuring that we have the opportunity to bring forward appointments for those people who want to bring their appointments forward based on the latest advice of bringing that forward to 4 to 8 weeks.
And do you have an update on where the specialist respiratory ward is at in Calvary? Is that all ready and raring to go now?
I believe that the construction work there that was required has been completed, but I couldn't say for certain, so we can get back to you on that.
The same question for you. Can you provide an update on what's being done to make sure people experiencing homelessness in Canberra are getting their vaccination, and also if we've seen any positive cases in that community?
So obviously there have been positive cases associated with both Condamine Court and with Ainslie Village. I would just emphasise in relation to Ainslie Village that the cases associated with that cluster are not necessarily all residents of Ainslie Village. And this is a mobile community, just like everybody else in Canberra. So there have obviously been cases associated with people who are living in social housing or indeed are not living in permanent accommodation. We've talked a couple of times over the last few days about the Access to Equity program that the ACT is managing in relation to ensuring that those people who are vulnerable in our community, particularly social housing residents and those who are homeless, can get access to vaccination. This includes Directions Health Services working under the Commonwealth program with outreach services through their mobile Ask Chat to Pat van that goes around regularly to social housing sites. That has been going to a number of sites, particularly in the inner north, but also to Oaks Estate on a regular basis to offer vaccination, and also to other public housing sites. So that has been an ongoing program over the last few weeks. Initially, Directions only had access to AstraZeneca. In the last few weeks, they've had access to Pfizer vaccines. We worked with the Commonwealth and with Capital Health Network to increase the supply of Pfizer to Directions to ensure that they were able to do those regular daily, daily outreach services to those sites. That includes at Ainslie Village on Saturday. They did in-reach vaccination at Ainslie Village. I can't remember all of the days of where they're going, but I know that tomorrow they'll be at on Ainslie Avenue, providing that service for people in the social housing on Ainslie Avenue. In addition, there is a program through the Early Morning Centre that is run in partnership with Interchange Health Co-op to ensure that the clients of the Early Morning Centre also have access to vaccination.
Sorry, just one last thing on this. Is there any word on what percentage of that community are vaccinated? Do we know how many people have their first or second dose?
Look, we can try to get you some numbers on that. I'm not sure that we'll be able to get percentage numbers because the denominator for that might not be entirely clear. But what we can get you is the number of people who have received a vaccination dose under that program.
Sorry, just a few questions around this. But if you received your AstraZeneca dose like 10 weeks ago to 11 weeks ago, can you also bring forward your appointment to this week, or is it better off just waiting the 12 weeks?
Yes, so anyone can bring forward their AstraZeneca appointment. If you've had your first dose more than 4 weeks ago, or up to 4 weeks ago, you can bring forward your appointment. So we really encourage people to have a look at doing that. This is obviously a response to the fact that we are now in an outbreak scenario. So this is in line with the ATAGI advice that in an outbreak setting, bringing forward that second dose vaccination to that 4 to 8 week period rather than the 8 to 12 week period is appropriate. Okay.
Just one about AstraZeneca. For people aged over 60, are there any circumstances where they could have the Pfizer or Moderna vaccine?
Yes, so there are a number of particular contraindications to the AstraZeneca vaccine. Obviously, if someone has had a first dose of AstraZeneca and has had an adverse reaction to it, then they shouldn't get their second dose. For those who have had a first dose and have not had that reaction, then they should go ahead and get their second dose. But there are also a number of contraindications, the medical names of which I cannot now recall, but which are all indicated on the ATAGI, the ATAGI and Therapeutic Goods Administration advice about those very specific contraindications for AstraZeneca for people 60 years and older.
Just one, Minister, on your the numbers of vaccinations in the disability community, was it 143 being vaccinated since the 23rd of August? Roughly works out to around 10 people with a disability vaccinated each day. Is that relatively low number concerning?
Yeah, look, actually it is. It is concerning, and obviously that is, roughly the number of people that we would do through the Access and Sensory Clinic, a little bit more than the number of people we would do through the Access and Sensory Clinic in our 2 days of operation. So we obviously want to see that number increase. We are continuing to work with the Commonwealth on their program for in-reach vaccination for people who are not able to get to one of our vaccination sites or indeed to their general practitioner. We have seen, I think, there has been some instances of hesitancy in the disability community about getting vaccinated. People with disability, many people, for good reason, have a level of distrust in the mainstream health system. And I think we've seen that early on. I think that is now dissipating, and I'd like to again thank all of those disability community leaders who are really encouraging people with disability to come forward and get vaccinated and saying that, they got vaccinated and really encouraging that. And obviously in expanding the opening hours of the Access and Sensory Clinic, we're really wanting to support people who feel that they need that extra bit of support to get vaccinated to be able to do that. But it's not the only choice for people. So really encouraging people to go to their general practitioner if they have access to Pfizer, or to come to one of our other clinics if that is going to be appropriate to them. And again, reminding people that you can call the vaccination booking line and choose option 3, and it's a very short wait on the phone line, and those calls are prioritised to ensure that people can make their booking. Great. Thank you, everyone.